Hi, this is Dr. Sujan Kumar, owner of this practice called Sai Yashoda Dental Care. We established this clinic way back in 2008 after I finished my post-graduation in Orthodontics, passed out from Sai Dental College, which is the top premier institute not only in India but also a very good college all over the world. You can see the rankings for user in any website in Google. First practice in this entire area with an orthodontist sitting in the clinic. We have practices earlier, but then an orthodontist was coming for consultation in the area of Chandanagar or Lingampalli or BHL. This is the first orthodontic practice when I started in way back in 2008. Not only orthodontics, we do many procedures. Basically, we cater to all dental requirements in the same roof. We have specialists pertaining to not just orthodontics but also endodontics or prosthodontics. And depending on the case, the consultant comes in, does the case and goes away. The patient is happy, consultant is happy, I am happy. There is no issue of any lag whatsoever. That's the practice, and today we'll just have a walkthrough to the clinic so that I can show the equipment we have, the technology we possess, and how we can cater to every individual, whatever the dental needs may be. Here we have our endodontist sitting all the time doing endo practices or crown preps or veneers. So we have specifically operative microscope for the same purpose, and we do endodontics as per the protocol mentioned in the textbooks. We use rubber dam for every patient, we use copious irrigation, we use ultrasonic irrigation, we use GP as prescribed for the patient. Microscope gives us more precise root canal treatment with less patient complaints. Patient can observe or can watch whatever is happening in his mouth on the TV because the microscope has got a camera and everything is projected onto the TV. So we have got an in-house scanner which not only caters to orthodontics but also whenever we do crown preps or implant cases or veneers, everything is taken scans. We are not using much of impressions these days. Everything is digitally taken up. When Invisalign came into the market, ours was the first case when Invisalign introduced its own scanner called Itero. We have a 3-shape scanner, it's called Trios 3. We are using this for the past 3 years, and that's the scanner we use. We have got a laser called as GenLace. All soft tissue procedures with bloodless and painless procedure are taken care of by using this laser. This chair we have specifically placed it for implant surgeries because these patients are a bit apprehensive owing to all the injections and blood and other things. So we use physio dispenser from Ostium company. As you've seen, all the chairs are from Ostium, so we use a lot of Ostium implant and the physio goes with it. Got an extra unit, intraoral radiography unit, RBG along with the portable X-ray so that patient need not move here and there. Everything will be taken care of the chair side. Now the fourth operatory of our practice. This is the area where I sit and when all that is my clinic practicing orthodontics. Reason why? Because it is nearer to the sterilization area, so the attendants can easily go in, pick up instruments, come back, clean between the patients and do the procedures. So we do a lot of aligners, as I told earlier. We use Invisalign, we use Spark, we use V-Clear, depending on the patient's malocclusion, depending on the patient's financial constraints. Accordingly, we select the appliance which actually not only suits the patient but will be able to treat the malocclusion. So I got my whole inventory, let it be brackets, let it be wires, everything in this area, and I practice here. Now these are sample aligners which I can show you, let it be of Invisalign or Spark, that's where we go about. So after the procedures, patients may feel dizzy, may want to take rest for a while. So we have got a lounge so that patient can happily relax for some time and then go their food. And this is the last part of the clinic where we have got an X-ray unit, it's called the orthopontomograph or OPG. We don't want the patient to go around to separate places, get an X-ray, come back to clinic. We don't want the patient to waste their time in this traffic and this. So we have an OPG unit. You can see the OPG over here and a monitor where you can see the patient can see his X-rays. As I believe seeing is more believing of the patient. So we take X-ray, show the patient what to expect, and then post op also we take an X-ray and show the patient. So everything is done in-house because the patient need not run to other diagnostic centers.